So there are many, many considerations that compete for our attention and our inclination when we're doing our professional work, whether it's therapy or assessment. And it is important to understand the personal and interpersonal nature of ethics and morality. I often say that in my work as a psychologist, I see people in a little room. I have an office that's 8 feet by 10 feet. Maybe you have bigger offices, that's lovely, but we usually see people in a room that's fairly bland, and we don't get to see them outside of that room, we often don't see them interact with others. And they tell us very, very personal things and very emotional things. And so it's very hard to not get our emotions involved, to not react to them emotionally. It's a very personal and interpersonal interaction, the way we work with people as mental health professionals. And that's what often leads to difficulties, especially if we're under stress. Not to mention that right now under the COVID pandemic, everyone's under stress. Many times the professionals are under as much stress as our clients are. And so that makes this all the more difficult, because most ethical decision-making models emphasize a rational approach. We have to be rational about this, which is very hard when we feel emotional and our clients feel emotional. And so it's important to incorporate the role of emotions and values to help us take real ethical action. We can't pretend that emotions are not important, that our emotions don't get touched, and that emotions aren't part of this. And I don't think that that really gets taught enough in any mental health profession or in any graduate program. Again, some of you may have talked about this, but I just don't think it gets talked about enough.